Good morning, everybody. How many of you guys have ever been admitted to a hospital? Most of you guys. And since I'm a tad bit older than some of you guys, how many of you haven't been admitted to a hospital have actually taken care of someone who's been admitted to the hospital? A friend, a colleague, a family member? Right? All of us. Well, I'm not only a physician, but I'm also a patient. And I've been admitted to the hospital before. You're admitted to the hospital as a patient. You have hundreds of thoughts going through your head, 1,000 miles an hour. And one of the common themes that arise from this journey is, why doesn't my doctor understand what I'm going through? Why doesn't he or she feel what I'm feeling? Well, as it turns out, doctors are data-driven. We're very analytical in terms of what we do, but we fail to see the nonverbal clues that are right in front of our face sometimes. It's been suggested that the eyes are the windows to the soul. And if so, when you look at this patient of ours, you can look into his eyes and see that his soul is hurting. You get a sense of hopelessness, a sense of fear, a sense of doubt. When you look into his eyes, you get an idea that he's all alone. Why doesn't my doctor feel what I'm feeling? Why doesn't he or she relate to me? Why don't they understand what I'm going through? Well, why does that happen? If that's the patient's point of view, what about the physician's point of view? Well, doctors, we're an arrogant breed to begin with. And our biggest commodity is time, or lack thereof. If patients have hundreds of thoughts going through their head at thousands of miles an hour, we have thousands of thoughts going through our head at 10,000 miles an hour. Harder, better, faster, stronger, as Kanye would say, right? When I am limited on time, and I've got to deal with your Google search engine, I don't have time to be your touchy-feely doctor. I've got to get home. I'm tired. I'm exhausted. Why do I need to think about how you feel? Do you ever ask me how many hours I've been working? Do you ever ask me how I'm feeling? Touchy-feely doctor? I don't think so. I'm just trying to get through your Google search engine questions for the day. But what happens in a situation like this is when the patient is acutely ill, and we really need to work together. Instead, we create an I and a you, and there is no we. There is no empathy, the ability for one person to feel what the other one is going through. At an acute level, because a patient is ill and in the hospital, this creates an incredible amount of tension. And they feel that something is missing. Why doesn't my doctor feel what I feel? And at a subconscious level, for the doctors, we're also creating a hole in our heart. It's just that we're so arrogant that we don't even realize that it's happening. And why does this happen over a period of time? After all, none of us became monsters overnight as physicians. In fact, most of us, when we go to medical school, we start off as idealistic human beings. We want to help people. We want to change lives, one person at a time. In fact, this is the fundamental reason that most medical students volunteer at homeless shelters, soup kitchens. It's not to buff their residency applications, okay? And they do this because they want to give back to the community. They want to be able to provide something to those that are less fortunate. Well, if that's the case, and they start off as idealists, then what happens? Where does the change happen? I think what happens is it's the environment and the role models that they're surrounded by. When I was a resident in training, we worked on average 100 hours per week. We were exhausted. And within a month, we were comfortably numb to everything. It was me, myself, and I. If I had to walk 10 miles uphill through snow, both ways, even in Houston, Texas, and hated it, welcome to my hell. Everyone else is going to do the same thing. And who was on the lower end of the totem pole than the resident? The medical students. As it turns out, we were the role models for our medical students. And in a short period of time, we took these kind-hearted, gentle, idealistic young men and women and turned them into Frankensteins. We turned them into a mirror image of what we had become without even realizing what we were doing. But wasn't there supposed to be some safety net? Didn't we as residents have role models? Well, as it turns out, we actually did. These are our role models. And I'm convinced that whoever came up with the show House built it around a bunch of faculty members that I trained up. Now I'm a faculty member, okay? And I've got some residents in the audience that are chuckling because they've seen the House version. In fact, a few years back, the graduating class gave me my own cane, just like House, with the inscription, "To our Dr. House, thank you for everything." At the time, I wasn't sure, am I being complimented? Am I being insulted? Or both? After all, I was still stuck in my own arrogant bubble. I'd earned it, right? 10 miles uphill through snow both ways. But as you get older, something changes. I'm on a busy teaching service at Bentop Hospital. We take care of very, very sick, acutely ill patients. And at any given time, I have 6 to 8 learners on my team. Students, residents, interns, and other people. And what I noticed over the years was I was doing a great job of teaching them how to take care of diseases. But I was doing a horrible job of teaching them how to take care of people. Over the years, and I've been doing this for 20 years now, the twinkle in my eye started to go away. Something was missing. We were failing to connect with each other. And what was even more tragic was that some of my medical students were showing up on service now, and their twinkle was already gone. It was as if we were creating monsters at an earlier age. Something had to change. We had to figure a way out to reconnect with each other and think about empathy. Well, as it turns out, the answer to the question of how do we reconnect is a lot simpler than I thought. All of us in this room, regardless of our socioeconomic status, our political or religious beliefs, right? It's election year. Our gender, our ethnicity, have one thing in common that always seems to bring a smile to our face since we're little kids. We all celebrate a birthday. And once a year, it puts a smile on our face. Granted, as we get older, we kind of count backwards. How old am I now? Okay? But it still puts a smile on our face. And I began to wonder, how many patients are admitted to the hospital in this critical period and they're actually having their birthday in the hospital? And if so, what would the patient's reaction be if his or her doctors came to the bedside, along with the team, the nursing staff, and other ancillary members, and gave them a birthday card that they had signed, brought them a smiling helium balloon, and their own little cupcake? Not only that, what if these doctors in their off-key voices, because doctors can't sing, sang happy birthday at the bedside? And finally, what if we finished off this impromptu celebration with a birthday hug? What would the patient's reaction be instantaneously to this celebration, which was a surprise for the patient? At times, there's family members at the bedside. What would the family member's reaction be to a bunch of doctors and nurses coming in to wish their loved one a happy birthday? And finally, what about the team members themselves? Could such a simple act of kindness finally remove the rust from the tin-man heart of the doctors that had gathered over the years? And just like that, the Cupcake Man Project was born. Over the years now, we have celebrated over 350 birthdays. We have done this with over 1,000 family members at the bedside, and we have touched the lives of over 15,000 healthcare workers. The entire celebration takes the entire celebration, let me put this back on, guys. It wouldn't be a presentation if we didn't have something go wrong. Good. Okay. The entire celebration takes less than 5 minutes. The cost of each birthday project, $2.50. And yet, the outcomes have been priceless. In fact, I formally measured the outcomes with surveys for 18 months. I'm in academics. No matter what you do, you better collect some data and measure it, right? That's what the bosses want to know at the end of the day. But don't worry, I'm not going to show you a bunch of data points today. Instead, I want to spend a few minutes here and be able to share with you the 360-degree viewpoint from the learners, from the patient and family members, and from the nursing staff about what the impact of the project's been. This is my team. What becomes obvious from the slide is that they're all smiling. What's not so obvious is this team is on call. And if you ever talk to students or doctors, they are never smiling when they're on call days. They're going to be in the hospital, got to eat crappy hospital food, going to get home late if you're going to get home. And yet here they are, smiling ear to ear, because they're getting ready to go and celebrate a patient's birthday. The impact? I'd like to read to you Rui's quote, who now is going to be a graduating fourth year from Baylor. The project is a stark reminder that a patient is not just an ethnicity, age, or diagnosis. They're someone trying to live with the burden. It communicates the compassion of the healthcare team and reminds the patients that life is wonderful and that they can trust those who care about them. And for teacher, this is all the honors that we need. This is a patient of ours who is critically ill in the intensive care unit. And we're very cognizant of each individual birthday as we look at the chart. We don't just walk in and say, surprise, happy birthday. And so as we approach this critically ill patient's family, we asked them if it would be all right if we shared their special day with a loved one at the bedside. And between sobs of singing happy birthday to this man, we couldn't stop but crying, both tears of joy and sadness, because as physicians, we knew that he was going to die. In fact, he died a few days later after we celebrated his birthday in the intensive care unit. But even after a year since his passing, I still keep in close contact with the family. And as we learned later, he'd been in the hospital for 6 weeks, but the entire time during the celebration, he's clapping his hands and he's smiling. And the family says, I don't know what you guys are doing, but please don't ever stop doing this. We will always be infinitely grateful to Dr. Mehta and his team. Our dad's birthday celebration was one of the greatest, most special moments we remember from the hospital. Small details filled with love can definitely help you find comfort in the most trying times. Shelley and Sarah. Then top, we have a lot of infectious disease issues. So we have patients in isolation. And even with good intention for care, sometimes these patients are isolated from the human touch. We always put on our SpongeBob yellow gowns and take the celebration even to the bedside. In a lot of ways, what we do in Ben Taub is a cultural melting pot of what the United States is. Different ethnic groups, different gender. We have a huge Hispanic population. We got an opportunity to celebrate the birthday here with the family members, especially grandkids. But what was unique about this experience is that we got to sing in Spanish, happy birthday. Still off key, but feliz cumpleaños a ti. And over the years now, we've sang happy birthday in 10 different languages. Okay? Pretty cool stuff. This is who I call my little angel. Just look at the expression on her grandfather's face and on her face as she changes his life from what we couldn't do with medications alone. He came very sick to the hospital. And why do I call her my little angel? Because I hope that someone like her will eventually grow up to be a big angel. And believe me, doctors aren't angels. We're not the angels in the hospital. The true angels in the hospital are the nursing staff. And what has been their perception of the Cupcake Man Project? This is the head of nursing at Harris Health, or what we grew up with as Harris County. It is often said that most people are not so interested in how much you know, but instead they are more interested in how much you care. I have never seen such a program in any hospital, and I think that this is an act of compassion that cannot have a value placed on it. Director of Nursing. So healing does truly begin and end with feeling. I hope you'll join me, because our ambitious goal is to celebrate every single birthday in the hospital nationally and internationally if we can. And hopefully in changing one life at a time, perhaps we'll end up changing our own. Is this the only answer and only solution to how we can all reconnect with each other, especially as physicians and patients? and show empathy with verbal and nonverbal clues? Of course not. But let's just say that some of the other options that we may have in the future have a few more strings attached to them. Thank you very much.